Welcome to Civitas LA, featuring diverse and emerging leaders who make up this dynamic region and are creating community every day and building a better tomorrow. These bi-weekly conversations enable us to hear from, learn from, and be inspired by a new generation of civic entrepreneurs who are forging a path forward in making our region a stronger, more resilient, and connected group of citizens. Our goal is simple: to elevate civic discourse, foster community connections, and promote civic knowledge and engagement across our region while elevating diverse and emerging voices in that conversation. Going back to the American Revolutionary War, African Americans have made significant contributions to our country in the area of science and medicine. Names we may not recognize include James Dunham, who many consider the first African American physician in the U.S. who treated patients with yellow fever in New Orleans; Rebecca Lee Crumpler, who worked as a nurse before becoming the first African American woman to earn a medical degree in the United States; Dr. Alexa Irene Canaday, who in 1981 became the first African American female neurosurgeon in the U.S., and closer to home, Patricia Bath, a pioneer in the treatment and prevention of blindness. She also advocated for eyesight as a basic human right by founding the American Institute for the Prevention of Blindness in 1976. Bath became the first African American to complete a residency in ophthalmology in 1973, which led to her appointment 2 years later as the first woman faculty member at UCLA's Jules Stein Eye Institute. In 1988, Bath became the first African American woman physician to receive a medical patent, which improved cataract treatment. So as Civitas LA continues to celebrate Black History Month 2022, we are absolutely delighted to have with us today Dr. David Carlisle, president of the Charles R. Drew University School of Medicine and Science, located in the Willowbrook community of South Los Angeles, and one of just a handful of Black medical schools in our country, as we discuss efforts to build a healthy community and their central role in training the next generation of health service professionals needed in our diverse communities. Dr. Carlisle, welcome to Civitas LA.
It is indeed a pleasure, privilege, and honor to be here. Thank you for inviting me.
Well, we're glad to have you here. Dr. Carlisle, on Civitas LA, we always ask our guests to share a personal introduction. Take it away. Tell us about Dr. David Carlisle.
Well, I don't know about a new generation of civic leaders. I'm probably not part of any new generation. I'm probably part of an older generation.
But you're training the new generation, so that there you go.
Training the new generation. I've been around Los Angeles my entire life. My formative years were spent here, although I wasn't born in Los Angeles, but my grandmother came here in 1917. But I've spent most of my time in Los Angeles, and if I'm not in LA, I'm always thinking about it. Mm-hmm. Absolutely.
Mm-hmm. Well, Dr. Carlisle, as we get to know our guests, we love getting to know your Los Angeles and starting out our conversation with a little lightning round. So share with us some of your favorites about Los Angeles. Are you ready?
Absolutely. Yes.
Give us a favorite restaurant or two.
Well, I would say Harold and Bell's. My wife would be happy to hear me say that because her family's from Louisiana, New Orleans.
Yes.
A second restaurant is Veronica's Kitchen, a Nigerian restaurant in Inglewood, well regarded. Absolutely.
Okay.
Post and Beam is on the list also in the Crenshaw Plaza.
Sure. Give us a favorite place to take a sip, whether that's coffee, tea, or cocktail.
Well, I spend a lot of time drinking coffee, probably no surprise.
Okay.
I just want to give a shout out to the Watts Coffee House on 103rd Street.
Okay, we haven't heard that one before. That's great. Give us a favorite place to take a visitor.
Well, apart from to our own campus,
okay,
the place that I like to take people to who are visiting Los Angeles is El Pueblo de Los Angeles.
Okay.
And I like to show them the pobladores, because LA, I think much to the surprise of many people, is a city that was founded by a group of people walking from the San Gabriel Mission,
sure,
half of whom were Mexican of African descent,
okay,
and half of whom were Mexican of non-African descent. So this is a city that was founded on the principle of diversity and inclusion.
Excellent. Outdoor space is something that we all so enjoy here in Los Angeles. Share with us a favorite park or a favorite hike.
Well, as often as I can, I like to hike up the Baldwin Hills Scenic Overlook.
Okay.
And from that point, I can see all of my Los Angeles.
Sure.
But I can see much of Los Angeles, period, as well. So that is a dramatic dramatic perspective.
Excellent. So you've given us some great places, but give us a hidden gem. Give us a place that some listeners may not be aware of at all.
Well, our institution, Charles R. Drew University of Medicine and Science, is often called the hidden gem.
Mm-hmm.
And, given that, I would say that is my favorite hidden gem. And I would encourage everyone to take a look at us. And obviously, we're going to talk a lot more about CDU today, and hopefully it'll be less of a hidden gem in the future.
Absolutely. Well, Dr. Carlisle, that is great. Let's begin our conversation. So, as I mentioned in my beginning, African Americans have played a significant role in health and medicine in our country for generations. You've had just such an illustrious career over, I believe, 4 decades in health sciences, going from Wesleyan to Brown to UCLA, several very prestigious institutions, and you have a master's in public health. So share with us how you got inspired to get involved in health, and what's the why that's motivated you along your path in the health sciences field.
I remember I was always very interested in the sciences, but I also had a formative experience in going to visit the doctor when I was little, and we were living in Virginia at the time, okay. Alexandria. And I noticed how crowded the waiting room was. I was so young, it didn't make any other impression on me, except there were a lot of people just waiting to see the doctor. And it showed me how important medical care was, but also showed me how important the role of an African-American physician was, because all these people were waiting to see this African-American physician. It was such a critical message, and that made a true impression on me. Fast forward, I continued my interest in science, but I also understood that in order for science to be successful, it requires an appropriate application. Hence my nurturing interest in health policy and healthcare delivery, even when I was in college.
Gotcha. Well, Charles Drew University is one of but a handful of institutions, Black institutions in the medical field. And you've been around since 1966, and it's the only Black medical school west of the Mississippi. Tell us about this school, how it got started, and its journey since its founding back in 1966.
Yes, we are one of 4 historically Black medical schools in the United States, along with Howard, Meharry, and Morehouse. Mm-hmm. And indeed, we're the only historically Black institution of any kind west of the state of Texas.
Okay.
And so that is kind of our lay of the land. Our university was developed in direct response to the Watts Uprising of 1965, otherwise known as the Watts Revolt, sometimes called the Watts Riot.
Yep.
Indeed, our campus is located probably a mile away from the epicenter of the uprising. Mm-hmm. The McCone Commission of that year called for the creation of an institution of higher education to serve South Central Los Angeles, along with a hospital. And from that request, that commission, commissioned by then Governor Pat Brown, CDU was incorporated a year later. Mm-hmm. So we owe our existence to the sacrifices of the people of South Central Los Angeles that were made in the summer of 1965. Mm-hmm. As a result, we continue to consider ourselves to be a community-founded institution. Mm-hmm. And community is a very important part of what defines Charles R. Drew University of Medicine and Science.
Sure. And what are some of the highlights along the way, along your journey over the years, some of the institutional achievements that you're most proud of?
Well, our institution was opened as the educational sponsor for LA County King Drew Medical Center. Okay. That hospital had, I think, 15 residency programs, all of which were affiliated with Charles R. Drew University at the time of its closing. But simply being part of a significant academic medical center was a hallmark for our university. Another hallmark was when the National Institutes of Health decided to invest in the growth of our research enterprise by creating our endowment program. Okay. So this was back in the late 1980s, and has really spurred the growth of our university. Mm-hmm. Fast forward to today, we're about to embark on something very significant, which is the opening of our own 4-year MD program at Charles R. Drew University. We expect to enroll our first students in the fall of 2023.
Mm-hmm. Well, I remember, when I was fairly new to LA and worked at the time for the Los Angeles Economic Development Corporation back in 04 to 08 period, there were some difficult times, certainly at the university and MLK Hospital, and, huge articles published about the hospital center, which was known, unfortunately, as Killer King. And I remember meeting you back then when I was on a probably LA chamber trip to Sacramento, and you were with the Office of Statewide Health Planning and Development. But you came down to Los Angeles to assume this role of leadership at CDU in 2011. So that was certainly a period of turmoil with regards to South LA and these two institutions. What did you see at the time? What compelled you to come down to take on this role? And certainly, how are things evolving? I saw where in 2017, Politico called this health facilities campus in the Watts Willowbrook area as the future of healthcare. So clearly things are evolving in a positive direction. But take us through some of that period and your move to Los Angeles to take on this leadership role.
Sure, and it was something that I was, again, privileged and honored to have an opportunity to do. I will say, when I was director of the of OSHPA, the Office of Statewide Health Planning and Development, we used to issue hospital outcome reports assigning letter grades to hospitals on a variety of conditions and procedures. And LA County King Drew Medical Center was never a negative outlier on our reports.
Okay.
When you adjusted for patient severity, when you adjusted for things like people coming into the emergency room in extremis, and when you leveled the table and the playing field to make comparisons across hospitals, King Drew was not a negative outlier.
Okay.
And so I eschew the term Killer King because I don't think it's an appropriate descriptor. Yes, there were some exceptional situations, but they're exceptional situations that pertain to every hospital when you look closely enough. And King Drew, of course, played a significant role in providing health care and trauma care where it was deeply needed in South Central Los Angeles. When I came to CDU, it was 4 years after the closure of King Drew Medical Center. And I was attracted by the combination of, an historic university that I'd known about my entire career that had some significant challenges, and the plan to reopen a hospital in South Central Los Angeles led by then Supervisor Mark Ridley Thomas.
Absolutely.
So knowing that the environment was ripe for positive change, it was a very easy decision for me to accept the honor and privilege to come to the university and be part of its growth and turnaround.
Well, certainly, since that time, we've seen where undergraduate applications have decreased substantially. CDU is poised for growth, and you're continuing to expand your undergraduate programs. And on the graduate level, your enrollments have been trending upwards for the last 10 years. So congratulations on that. So what's been your vision for growth of the school and its programs, and what do you attribute the success that you've been having?
Well, in answering the last question first, we are a unique institution in that we're focused on the health professions. And young people today know that if there's any path to empowerment and self-actualization, the health professions are one of those pathways to take. We're in a community where higher education is transformational, or there's a hunger for higher education, and so we're in a position to satisfy that hunger. So a hunger for higher education, access to health professions is kind of a perfect storm for people to be interested in CDU. And so that's really I think what's empowering our growth is that we are speaking to the demand that exists for higher education on the part of young people today. Plus, we tell young people there's a difference between, and I'm quoting our provost, a house that's built for you and a house where you are just the visitor. And CDU is a house that is built for the young people of South Los Angeles to allow them to transform their lives and their careers in a meaningful way so that they can go back and serve the communities that they grew up in.
Well, that's an important point that I'm glad you mentioned that, Dr. Carlisle, because I know you're training the next generation of healthcare professionals, and I understand roughly 85%, if I'm correct, of your students indicate that they intend to remain or practice in their community. So tell me about the students, where you're attracting these students from, who are they, what are their backgrounds, and where are they going, where are they migrating to professionally?
Yes, our students always make me proud. If my batteries are running down and I need to get recharged, I just go out and walk around the campus and I interact with our students. And CDU is not special. I think that's true about most universities. But one thing that is special about CDU students, 80% of them come from Los Angeles County. The vast majority say they want nothing more than return to their their home community as a healthcare professional to improve the health of that community. And what I'm particularly proud of is I'll ask a student, where are you from? Where'd you grow up? And they'll typically say, oh, Dr. Carlisle, I grew up right around the corner. I'm from 120th and Central. I'm from Compton. I grew up in Linwood. I grew up in Watts. And when I hear that, that tells me that CDU is doing exactly the mission that we were created to do back in 1966.
That's wonderful. What are your student enrollments, may I ask?
Right now, we're at about 1,000 students. That's pretty much an all-time high. We haven't increased much during the coronavirus pandemic. Our biggest program is our Mervyn M. Dimely, named after California's first African-American lieutenant governor,
Sure.
School of Nursing with over 500 students. We have our College of Medicine, and that's about to have its own four-year medical school.
Mm-hmm.
And we have our College of Science and Health. So the Mervyn M. Dimely School of Nursing is our biggest program.
Mm-hmm. Well, you just touched on growth and leveling off during the pandemic, so we can't obviously get through this conversation without talking about the pandemic, which we are still in, and certainly its impacts on communities of color and South Los Angeles. So, with over 4 decades of experience in healthcare, I'm curious to get your perspective on what the pandemic has highlighted for you in terms of healthcare, health inequities, and how CDU is responding to these times.
Well, the first message is we have to be always ready for a pandemic. And
Okay.
as a public health person, I've been aware of the potential of pandemic or epidemic illness my entire career.
Okay.
I trained at Harbor UCLA Medical Center, LA County. We were always vigilant for diseases coming into the hospital from LAX, from LA Harbor,
Okay.
from people arriving in the United States from across from overseas. And so this is part of healthcare, is knowing about the possibility of these pandemics. In terms of the coronavirus pandemic, I remember in state government, I'd already worked on SARS.
Okay.
Back in the early 2000s.
Mm-hmm.
And we knew how bad SARS could have been, but it didn't become as bad as it could have been at all.
Mm-hmm.
So when I woke up at about 5:30 in the morning on December 27th of 2019, and I saw a headline, I forget what news service it was on, unknown pneumonia in Wuhan, China.
Oh, wow.
My first reaction was, where is Wuhan, China? And I discovered it's a city as big as Los Angeles. And I said, oh no, I hope we're not about to go there again.
Oh, wow.
I was very much worried about SARS. And as it turned out, COVID-19 has exceeded the worst of the SARS outbreak.
Mm-hmm.
What it has portrayed especially is the ability of a respiratorily transmitted infection to transcend any barriers put in place internationally, and then also take undue or disproportionate advantage of underserved, under-resourced populations.
Mm-hmm.
In fact, if you look at the LA Times data on COVID-19, the population right now that is being hit the hardest is the African-American population under the age of 17,
Oh, wow.
with deaths from COVID-19 more than twice their presence in the population. No other demographic category is dying from COVID-19 now more than African Americans under the age of 17,
Mm-hmm.
proportionate to their share of the population.
Yeah. And how has CDU, along with MLK Community Hospital, engaged with community during this pandemic? And what lessons are you taking away from the experience? And how does it inform your work going forward? And how do we create a healthier community for our African American, Latino populations and underserved communities?
Yes, and I do have to take my hat off to MLK Community Hospital, which I did figuratively when I gave a lecture online there a few months ago.
Okay.
But they are very much at the front lines of the COVID-19 pandemic. They've been seeing more cases than any other hospital in LA County. They have nursing staff who are living out of their cars because they're doing double and triple shifts. They've had to open up tents outside their emergency room to take care of patients, all under the able leadership of their CEO, Dr. Elaine Batchelor. So there is no greater set of heroes in the COVID-19 pandemic than the staff of MLK Community Hospital. Our university has joined with that hospital in fighting COVID-19. We opened one of the first testing centers a couple of years ago in South Los Angeles, often doing 80,000 tests, often 1,000 tests per day.
Wow.
We then switched to vaccination. We've been doing operating mobile vaccination vans throughout South Los Angeles. And we've been speaking to the need for testing and vaccination throughout South Los Angeles as well. I myself, through a program led by the California Department of Public Health called Vaccinate All 58, have been speaking to a number of religious organizations about the need for vaccination. So COVID-19 has preyed upon the African American and other communities of color disproportionately. And CDU, because we're a community-oriented, community-founded institution, has joined with those communities at the front lines of the battle against COVID-19.
Well, I know you've taken a leadership role with regards to vaccination, and we hear a lot about vaccine hesitancy, particularly in communities of color. How is the Willowbrook community responding to these initiatives, and how is the faith community and other community leaders rising to the challenge of getting the word out?
Well, I've been gratified by the response. Yes, hesitancy is there. And the first thing I tell people, especially people who are hesitant, is I understand your hesitancy. This has not been a healthcare system that has had you at the top of its priority list. We have healthcare disparities everywhere we look. And I understand why you don't trust the healthcare system to care for you and about you. And then I say, and that's why I'm here. I'm here to advocate for you on behalf of a healthcare system that I represent, which does care for you and about you. And I'm most gratified when somebody who's been hesitant for weeks and months comes up to me and says, Dr. Carlisle, I just got vaccinated, and you know what? It was because of you. And that tells me that we can reach out to people and connect with people who are hesitant, because we go to church with those people. We see them in the supermarkets. We see them outside. They are our community, and that's why it's important to have a university like CDU.
Yeah, and are you seeing this hesitancy in any particular groups, whether it's gender or age? Is there any commonality, or is it across the board?
It's really hard for me to focus on any particular group. I'd say it's across the board, especially at the level of our direct interactions. Data suggests that young people may be more hesitant than older people. But I think it depends on when you're looking at what data, basically. So I'd say hesitancy is pretty much across the board.
Sure.
And anywhere you look, you can find vaccine hesitancy.
Well, certainly one of the things we like to highlight on Civitas LA is the importance and role of collaboration and partnerships, and we always want to spur that in these conversations. And we discussed your plans earlier for undergraduate program expansion, and it seems to me that CDU is on a little bit of a roll because I believe you received a nice, healthy grant from the state of California, around $50 million to support your programs, and you received another investment from the Bloomberg Philanthropies Greenwood Initiative, which was the largest private gift ever made to the university. So congrats on all of that. And what does that mean to the institution, and how do you plan to leverage these collaborations to expand the work of the institution?
Well, it means two things. People are hearing our message, and they are and they're appreciative of our results. Let me just share with you. CDU was just ranked number 5 as in terms of new graduate pay in the country by Forbes magazine. Number 5 in the country among over 2,000 private not-for-profit universities. We are ranked number 3 by the Brookings Institution as a value-added university. Number 4 was Caltech, taking students from very challenged origins and turning them into successful mid-career professionals. We are ranked number 2 in the country in terms of both faculty and student diversity by the Chronicle of Higher Education Almanac, and recently number 1 in the country in terms of return on investment for low-income students. If you're a low-income student and you want to invest in your education, your return is number 1 at CDU. And we're also ranked number 1 in the country in terms of our master's degree in biomedical sciences. So CDU has a record of accomplishment, and people are recognizing it. And that's why people like Mayor Bloomberg and people like Governor Newsom and the California legislature are so supportive of CDU. And they just want us to grow and prosper so we can do even more of what we do so well.
Well, that's great. Well, I hope you will share with us some of those rankings, because we love to post that as we promote the episode so people can see this as well. That's terrific. And so those are great collaborations. What other types of collaborations and partnerships are you all engaged in currently, or looking for to grow your activities? How do people get involved? We always want people to know, how do they get involved with you and your organization to support this work?
Well, I would say, first of all, that anyone who wants to get involved should reach out to me directly. And we have an email address. It's president@cdrewu.edu. And that's how people can reach me. But, some of the most significant collaborations that we've had recently, the most productive ones, have been with Los Angeles County.
Okay.
And of course, Willowbrook is part of LA County unincorporated area. And of course, we're south of Watson, north of Compton. But the county supervisors, led by then Supervisor Mark Ridley Thomas and now by Supervisor of the 2nd District, Holly Mitchell, have been great collaborators of ours. The LA County Department of Health Services and Director Christina Galley have sponsored our residency training programs. The LA County Department of Mental Health under Director Jonathan Sharon have also sponsored our psychiatric residency training programs.
Okay.
And the LA County Department of Public Health has sponsored a public health pipeline program for us. And these are all individuals that we work with very closely because they know the importance of improving the health of the underserved, under-resourced community of South Los Angeles. If we can improve the health in South LA, it'll have a dramatic effect on health throughout the state of California. And so I just want to again recognize the great collaborators that we've had with in Los Angeles County.
No, well, we appreciate that. Well, Dr. Carlisle, you've had 10, 11 years now, so that's a long tenure these days as head of institution. So you're just getting started, it seems. What do you envision for the future of the university, and what do you see as opportunities for minority health professionals in particular?
Well, I'm looking forward to continuing to work with our healthcare leaders, including people like Bob Ross of the California Endowment, the Uni Health Foundation, et cetera, et cetera. And really, if you're going to effect change in healthcare, you have to focus on where healthcare is doing the least.
Okay.
And that is our under-resourced communities, typically communities of color. And I'll mention rural communities as well, Central Valley, Northern California, where you can't find healthcare. You drive around South Central Los Angeles, you don't find private practitioners. You don't find private dentists. You don't find private pharmacies. You don't find private mental health workers. Fortunately, we have our federally qualified health centers like the Watts Health Center, where I got my start on my career, St. John's, et cetera, Altamed. But if we didn't have those organizations, we wouldn't have any health care in South Los Angeles for the most part. And so there is a profound need to train healthcare professionals who identify with communities like South Los Angeles, who want to go back to those communities once they finish their health professions education. And if we want to really affect change in healthcare, this is an essential ingredient. Getting healthcare professionals who come from the communities that we need to provide services to.
On that point, I've got a thought, and I know we've touched on it in earlier episodes where we've talked about access to STEM and getting girls of color, boys of color interested in STEM. What do you see as the challenge in particularly early education with regards to getting folks who may be interested in science and keeping them involved in science as you were? I'm just curious.
And I know we're talking about early education, but I will say this is the impetus for the growth of our undergraduate education at CDU. We weren't always an undergraduate school.
Okay.
But when you look at the pipeline from kindergarten into the graduate health professions, the biggest leak in that pipeline actually occurs during the undergraduate years.
Okay.
Students come into college and they say, I want to be pre-med, I want to be pre-dental, I want to be pre-pharmacy, I want to be a nurse. And at some point along the way, they become an academic casualty. So we need to, CDU is on a mission to plug the leak in that pipeline all by ourselves, because we can be a Xavier University of the West Coast. We can be a Spelman College. We can be transformational in undergraduate education as well. But we know to feed our undergraduate educational process, we need to work on the earlier points in the pipeline. And this is why we have programs like our Saturday Science Academy that takes young people as young as the age of 4.
Oh, wow.
And teaches them to love science, technology, engineering, and math. At the end of their 1-year curriculum, and it gets repeated every year, we give them a white coat at what we call the junior white coat ceremony. Okay. And they're introduced as Dr. Gutierrez, Dr. Jackson. And when you say doctor in conjunction with their last name and they walk across the stage, you can see them beaming.
Oh, that's outstanding.
The light is going off in their eyes. And they're thinking, well, maybe I can be a doctor or a dentist or a pharmacist or a nurse. And at that point, the rest is much easier.
Yeah.
And so we focus on the pipeline as well. And we want to be a symbol, an inspiration for young people to show them, yes, you can become a doctor or a dentist.
That's great. We need to find a sponsor out there for the white coats for the kids. That's wonderful. Well, Dr. Carlisle, this has been a great conversation. We're really excited about the work that you're doing there down in the Willowbrook area, and we applaud the team that you've pulled together to do this important work. As we like to say on Civitas LA, the guest gets the final word. Any concluding thoughts you'd like to share with our audience? Any advice to young people today who may have a calling to service, especially in the healthcare sector?
Well, I'd like to say, thank you on behalf of our students, our faculty, staff, trustees, and alumni for giving me a chance to be on the show. I just want to ask people to reflect on our vision statement. Excellent health and wellness for all in a world without health disparities. That is what we are trying to achieve at Charles R. Drew University of Medicine and Science.
No, that's outstanding, and certainly we know of the important work that you are doing and Dr. Batchelor is doing down there, and you guys continue to grow the physical infrastructure and the human infrastructure to serve community, so we applaud that work. This has been a great dialogue, and I appreciate your time today and appreciate all that you're doing for our community, not just in South LA, but across LA County. And hopefully we can have you on again to discuss the progress that you're making. And hopefully you can bring Dr. Batchelor on with you next time as well.
Sounds like a plan.
Okay, that's wonderful. And to our audience, we appreciate you as always. Thank you for tuning in. We hope you enjoyed this program. And we again extend our deep appreciation to our friends at Community Build, Inc. for their interest in our work and their generous support of our Black History Month series. We hope you'll join us in 2 weeks as Civitas LA launches its Women's History Month series. And until we meet again, as we like to say, stay strong and get involved. To learn more about Civitas LA and to share feedback on this program or recommend a future program, please visit us at www.civitasla.com. And don't forget to connect with us on Facebook at Civitas LA, on Instagram at Civitas_LA, and on Twitter at Civitas_LA.